As we've been reporting, it's all hands on deck at hospitals and clinics across the country these days. But as governors call for reinforcements, thousands of healthcare workers in the U.S. under the DACA program face the possibility of losing their jobs and even getting deported if a critical Supreme Court decision doesn't go their way in the coming weeks. Here's ABC's Devin Dwyer.
I've been working since 6:30 this morning. It is right now 12:30 at night.
For Florida paramedic Aldo Martinez, long days and high stress are the new normal.
It's been about 18 hours of call after call. You can even see it on my cheeks, the redness from the mask, the N95 masks that we have to wear.
Martinez is one of an estimated nearly 30,000 immigrant physicians, nurses, technicians, and aides who have U.S. work permits through DACA, the program started by President Obama that grants temporary legal status to undocumented immigrants who came to the U.S. as children. Martinez was born in Mexico.
If somebody from your family was having a heart attack or a stroke or had just had an accident, and now we have 27,000 people less to respond to those kinds of emergencies. Just something to think about.
Those immigrant workers on the front line now facing an uncertain future after President Trump canceled DACA in 2017, threatening to end work permits and worse for the more than 650,000 who enrolled in the program.
Every day I wake up with the uncertainty, not knowing if DACA will end or if I may be deported, and that's a hard reality to face.
Denise Rojas is a medical student at Mount Sinai, now helping COVID patients in New York City.
What I do know is at this very moment, I can be of help in this crisis, and that's what I intend to keep on doing.
In Rhode Island, that passion driving DACA recipient Crescia Rivera, a third-year med student at Brown.
I've been helping at my local Department of Health to help call patients who test positive and call their close contacts to make sure that they're doing well.
And in California, there's Dr. Nu Ledavangskorn, the first undocumented immigrant to graduate from the University of California, San Francisco Medical School.
It is just yet another example of how immigrants, particularly undocumented immigrants, certainly DACA recipients, continue to show up and do what we can to be a part of this country.
The fate of DACA and those essential health workers that rely on it rests here at the Supreme Court. It's closed during the pandemic, but the justices expected to hand down a decision any day.
If the Supreme Court upholds the decision to cancel DACA and my DACA ends in August 2020, I will be left with the question of whether or not I will complete my residency training.
Dr. Ledavangskorn and other DACA recipients have written the justices to factor the pandemic into their imminent decision and throw a lifeline to immigrants on the front line.
These are people who are actually on the front lines. There are some 200 of them that are practicing doctors. There are statistics that show that every doctor treats around 5,000 patients per year. Multiply that by 200, and in a pandemic like this, doctors are treating a lot more.
The Departments of Justice and Homeland Security both declined comment to ABC News on the role of DACA recipients responding to COVID-19 and whether they've studied the impact ending DACA would have on the U.S. health system.
Every single one of these professionals right now is precious to our systems. It is absolutely not appropriate to say that these people should put their lives on the line for the rest of the country, only to have their fate hanging in the balance.
The president says DACA is unconstitutional. Congress could enact a solution, but has repeatedly failed to do so. That leaves the Supreme Court in the tricky spot of deciding what's next.
They need to understand that we are essential, that we are productive, and we provide for this country, for the people that they love, for the people that we love.
A plea for empathy and understanding.
If the Supreme Court decides to eliminate the program and Congress doesn't act to pass the legislation for us, it would put my career as a physician at a stall.
So much on the line while the fight against COVID-19 goes on.
I continue to chug along with my community and just hope for the best, because sometimes that's all you have is hope.
For ABC News Live, I'm Devin Dwyer in Washington.
Really important storyline there. Our thanks to Devin.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.